Good evening, everybody. How are you? This is Dr. Rao. I was working on something for somebody in the family who is coping with illness. And I want to bring in the insights I kind of absorbed and learned over the years of how to handle or cope with chronic illness, especially. Um, if you have an acute illness, you would definitely uh, deal with it and then come back to it, and then you'll probably go back to the work and everything. But still, these are also applied to that. So I just want to uh, let you know how this works. I'm actually going to do a workshop on this because rather extensive discussion here. So I am preparing some slide presentation, and I'll do it probably next weekend. But meanwhile, I just want to touch some basic uh, applications or practical applications of the teachings from the ancient wisdom, especially a philosophy called Advaita Vedanta. That means everybody is one, and that's how the philosophy looks at everything, right? They all think all the uh, human beings are in one family, and we're all in one consciousness, and consciousness is the main thing. Body, mind are projections of that. So it kind of teaches you to understand that inner divine self is everybody, and everybody is in one divine self, right? So that kind of understanding really um, gives you a lot of tools to deal with illness. When you are ill, when you are coping with a chronic illness, I had a lot of patients like that, right? Almost when the clinic is being run, there are so many patients that are really having two or three chronic illnesses. So this old age is terrible in America, they used to say, and they were suffering joint pains, they were suffering chest problems, they were having breathing or chest pain, and they cannot get up and walk, and they have problems with eating foods because of the diabetes. So generally, standard is people have diabetes, arthritis, heart disease, or COPD if they're smokers, or something like that, or hypothyroidism, or mental illnesses, so many things, right? So it's a really, I was very moved when I saw people are suffering with these chronic illnesses for a long time. And then the modern approach is just to give them medications and expect the medication to do everything, even if they are feeling bad about it in the mind, or if they are really depressed about it, they send it to the psychiatrist. But what I'm going to present to you, there are some teachings that to cope with illness, right? I'll be brief in this presentation today, but as we go into deeper and deeper understanding, you will definitely see the value of doing it like a whole 1 hour, 1.5 hours like that. Okay, so I'm going to do that for you, but this is like a giving you a taste of what is to come, right? So suppose you are chronically ill, chronically addicted to prescription medications, chronically ill and then confined to institution like a nursing home. That will be really, a lot of people go down the moment they kind of take away their home and their familiar surroundings and nobody to come and see them. That makes them much more sick. So there are some key themes and insights. First of all, let me tell you, I'm a physician who practiced more than 40 years in the United States, treated a lot of acute illnesses, but also have background in the geriatric medicine. That's how I started to begin with, right? So I was aware of the geriatric population. They need special attention, special, um, you know, kind of insights to cope with it. So the key theme is um, Number one is if you can accept what cannot be changed. For example, you have a injury and you have a hip joint placed in you and your mobility is limited and you cannot do all the things that you used to do, like climb up a hill or go for a walk or run. So many things people enjoyed, they had to forego them. And then they kind of very sad about it, recollecting the loss all the time. So it's very difficult, but then if you look at the wisdom of it, accept what cannot be changed and only work on the things that you can change. That will save you a lot of mental anguish, mental, tension and unhappiness and all. Right? So anybody can see that, but are you doing that? That's where you're being in the present moment awareness. That's where you want to build up something from now. That's where you want to not allow the condition that you already had is going to rob your mental peace. I'm not saying everybody does it. A lot of people feel bad about it. So cultivate the attitude of accepting what cannot be changed. Number two, if you have a pain, you can distinguish the pain from suffering. I talked about this several times, but pain is, uh, you know, inevitable, but resulting suffering from it is not. Right? So you can have an attitude about pain, build up the threshold, understand the whole spectrum of pain. Lots of times, people are worried about maybe the pain will come back after my pain medication worn off, and they're more worried about that, and that thinking makes it much worse. So understanding that and observing the thoughts, and then let them go and use all non-invasive measures like a breathing, like some creams or some exercise, some relaxation exercises. All those things help you. But main thing here is that inner Advaita self, where we are all being. And if you can separate your thinking from that being, then pain can be handled much better. Okay? So there's a lot in that. It's not just a simple statement, but there's a lot in that. A lot of people suffer because they have this pain that cannot go, that cannot be treated by any measures and all that, right? So we see the lot of suffering from the pain medications, and we see a lot of deaths and a lot of morbidity and disability and all that, right? So that's the second principle. Distinguish pain from suffering. Okay, I will go into details of that as I present it about the weekend, and I can talk, much more at length, and also more people probably will be invited and see whether they can present their viewpoint too. So number one is acceptance of what cannot be changed. Number two, distinguishing pain from suffering. Then, if you can cultivate equanimity and also inner steadiness, that is the one which gives you a lot more acceptance of people, things, and circumstances. And your steadiness is important because many people react with the sympathetic nervous system, fear or anxiety and all that, right? So that excessive activation of sympathetic nervous system, limbic system we call it, and that is the one which causes a lot of stress hormones and a lot of damage. That is the bane of the modern civilized working conditions, where people are afraid of what may imagine, what may be really coming up, but then they are not able to put things away from the past or imagine a lot of dangers in the future. And they are kind of, so we always tell them, hey, you activate your vagus nerve, your parasympathetic nervous system with a regular practice of breathing, and other things are there. But it basically, that kind of breathing will give you a lot more steadiness inside, and also parasympathetic nervous system that is activated will help you better. And The fourth one is, if you can develop an attitude of detachment from outcomes while focusing on duty. This is something a pet thief I always talk about. Don't worry about the outcomes. Just focus on the process. Focus on the duty that you have to do. So that is the karma yoga, so yoga of action that is done without profits or without outcomes. But the Western society, the worldly society, the consumer society built up on getting the outcomes come up, and then good result of a product is okay, but then what you want to get from it, that's the problem, right? How much money I will get, the lust and the money and the positions and all those things, right? We know this is happening. So it's very difficult for a lot of people. Even the doctors, when I see them, I always ask them, do you want to serve the patient, relieve the suffering, or do you want to help yourself to get wealth and fame and name, and thereby you feel good about yourself? Lots of times people, honestly speaking, they say, I'm only looking for my welfare, I'm going to serve, I'm going to provide work, but I have to have some return for that. Returns for the necessity is one thing, but returns for our mental attitude of having more, that's the problem. And also, you can make a plan, you can make goals, but if you are thinking of the goals only, then when you are working, you won't have the full quality of attention on the work. That's what I'm talking about. Be in the moment, be in the present, be completely paying attention to what is in front of you. Then you'll have all the energy going into that, and you will be okay. If it fails, then you will learn from it and go forward. You won't be crushed. So basically, your nervous energy is consumed very well if you can develop detachment from outcomes. This is a big, big deal. I know people don't even admit that they are doing only for their selfish needs or egotistical needs rather than something that's bigger than themselves. Okay, even stress feeling, if you are focusing on a goal that is bigger than you, your life or your family, then you feel so much more by giving honest service, right? So for how many we did? Four of them. First one is acceptance of what cannot be changed. Second one is distinguishing pain from suffering. A lot of chronic illness people have this pain. That's what I'm brought it up. And then you want to cultivate equanimity and steadiness within you, not to be rattled by something already there. It's going to be there for a while, right? And then detachment from outcomes while focusing on your duty. Your duty is, for example, you are doing a job, you have some pain and all that. You want to do the meaningful treatment of that, if that is there, or um, discovering ways to cope with it and all that, right? And the fifth one is, so if you are a God-fearing or God-believing person, or you think there's a divine order, that's what I think. There's a divine order, but when we give a limited shape and name for that, but I think it's surrounding us everywhere. That energy, that consciousness, that is always there. So faith and surrender and trust in that divine order makes people feel much better, even though they're having a lot of afflictions physically, mentally. This kind of surrender attitude really helps people to not to carry the burden by themselves. It's like you have a suitcase you are carrying to the railway station, but you are in the rail, you don't want to carry it with yourself. You give it to the train. Like that, you can also have that attitude. It's important. A lot of people. You may not believe God and all that. You may not believe in his external order, but a lot of people are really feel like that. So faith, surrender, and trust, that helps these people who have the chronic disease. Okay, and then if you have a spiritual practice, if you have something that you are doing every day, like a puja, like a meditation, like a charitable work, service people, all those spiritual practices, you want to do them consistently. So consistency in spiritual practice, even you are having difficulties. So consistency in spiritual practice under difficulties is very, very important. And the last one is, if you cultivate a habit of having silence, self-reflection, and inner listening, listen to your own attitudes, your own responses, your own worries, anxieties that are coming up within your mind. So you want to look at them from distance. You want to listen to that inner chatter. You want to really reflect on them. And thereby you have a use of silence with that. Okay. So these are the 7 key themes or insights. Okay. Anybody has any contribution to that? You want to tell me something about them? What do you feel about it? Or you want to ask me a question? You can come up now before I go into the what do we do, the action items daily today. These are only themes and insights that you can develop, you can understand, you can make them happen in your life. So you will be much better than, see, basically, our mind does a lot of things. So you want to understand these principles of the ancient wisdom. For thousands of years they cultivated. So they cope with illness much better than modern times. Modern times also breeds some problem. For example, a lot of pain medication use is really given by the doctors and nurses who give pain medications very easily to people. Suppose you are conservative and you want to help them with the non-invasive measures to measure with the cope with the pain of any sort, unless it is really uh, a kidney stone or a sharp injury or anything like that, we have to give something right away. Otherwise, people have joint pains and then they have been having it for years, and people think pain itself is suffering, and then they create more suffering for the people giving freely, like M&Ms, they give all these pain pills and all. The culture has become like that all over, right? Not just in America, even in India also, a lot of people want pain medications, right? So that is something that we want to really, encourage. So anybody wants to come up and ask me anything on this, principles that we talked about? All right. So if you are satisfied, let's go to the list of things I want to propose. Like I said, this is going to be much bigger talk and more exposition of each of these themes and insights, and also what are the daily to-do things that we can do. I'm going to present you like a 10 of them, okay, that you can, do something, so that you can cope with the illness better, okay. Number one is, again, acceptance of the practice, right? We begin the day with affirmation, I am going to accept what I cannot change. That is number one, you want to say in the morning. And that way you don't go there and say, oh, I can fix everything. Oh, it's all in my purview. Not really, some things are not, especially with the illness I'm talking about, chronic illness. If suppose you have arthritis, osteoarthritis, and they're eating your cartilage, and then you are more afraid of the pain, that's why you don't move. So it's going to be progressively get worse. But if I had a daily routine like a head to toe yoga, which I do, that would be like a limbering of all your joints. Actually, I make a lot of farmers do them while they're working. So if they're working the joints too much, they should have lubrication of the synovial fluid, and then just doing those. Suppose you are active worker and you're doing all that, even then, if you don't protect your muscles that are supporting the joints, then you will develop this arthritis and all that, right? So get up in the morning and say, I accept what I cannot change. Number one. Okay. Number two, you want to really be a mindful observer about your pain. Okay. Are you observing the pain that is aching you or causing problem, or are you having this mental reaction? Okay. And so you want to understand the resistance. You want to understand, are you identifying with that? So you want to notice pain versus mental reaction, label resistance without identifying. Okay, if you have resistance, label it, but then don't identify it. Okay? So it's about what your mind is doing to the pain rather than pain itself. That reaction you don't want. A lot of times, if you talk to the pain medicine doctors, they will tell you 75% of the pain problem is that they are thinking about it, expecting it, and then dreading it coming on. Okay, so that's something that you want to see. Can I observe my reaction to the pain away from me? And that's it. It is happening in my mind, but I'm not the mind. I am this inner self. So I can observe. See, thoughts happen to you. You don't happen to the thoughts. Observe the thoughts, like that reactions also, other thoughts, right? And then you can always put a journal and say, am I really equanimous in everything? Every night you reflect on the balance that you are keeping and where you allow yourself to be, uh, you know, partial to somebody or nepotism or any of those non-equanimous things, or according to the race and all that, right? So people do that, all the time. So, but they don't admit they are doing it. So for yourself, you just want to reflect nightly, how was my behavior all day? Did I do anything that is non-equanimous and all that? So this is something you can do. So you can, in the morning, do the affirmation that I accept what I cannot change. And if the pain comes, observe the reactions. That's the second thing you could do. And then at night, you could do a equanimous journaling your own behavior. And of course, you are working, you are doing your duties, then you want to be more duty for the duty's sake. That means duty-oriented action. So define your tasks that you need to do as your duty, and then always see whether your focus is on your results or on the process. That's what we talked about karma yoga, right? So you want to say duty-oriented action, not expecting results, not expecting profit. Very difficult for the consumer society people. But if they do that, then even though they are ill, they are able to accomplish a lot of stuff because they are duty bound and they are not expecting anything in return. That itself sometimes revs up your energies. Okay. And if you are spiritual, you are devoted, and you want to have a prayer, a mantra japa, or a surrender practice, do that. Do that devotional ritual at least 5 minutes daily. Okay, that's the fifth one. And you want to have this for sure. The next one is a consistent inner practice. Don't say things, practice them. Maintain meditation. Study, understand things, question them, and then discuss and all that. Okay? Or most important is silence. Are you practicing silence? Just meditating, sitting down, repeating a word is not the thing. What is happening after that repetition? Are you silent? Are you quiet? Are you able to understand the waves of thought, waves of movement of thought that's going on? Is it going on continuously, or you are experiencing and enjoying the silence. Try that. Okay, so you can have a silence retreat. Okay, you can schedule half a day or full day just to silent, be silent and recharge yourself. That is the big thing you want to notice. Are you recharged after the silence? Try that. You can name that as a silence retreat. I'm going to do once in a while, either weekly or daily or whatever, right? Whatever suits you. Okay. And then you also want to develop some prompts for reflection. Okay. Ask, what is in my control? And how am I responding in adversity? So you can always have support network. You can do satsang with me, other people, and so engage with your community to share insights and environment. But I'm more like a supporting yourself by reflecting things and then knowing more about yourself. Okay. The other thing is you can share these insights that what you are doing, and you can teach them too. So all the insights that you have translate into teachings, workshop, or client sessions, whatever, right? So this is, in brief, like a coping mechanisms in the illness, chronic illness especially. Okay, um, hopefully that appealed to you. And I hope people have some idea about what I'm talking about. If it is there in your life, that's when you want to really understand and they say, okay, it is in my life, let me apply this, or at least a few of them, or am I doing them already? Then you come up and tell me what you are doing upon what I mentioned. Okay, or anything else that you yourself do on your own. Okay, but I thought, because I always encourage proactive wellness, that's before you get illness, right? But then if you have illness, what do you do? Already you are ill. How are you coping with it? So this is like an insight into how the ancient wisdom can help you to be developing these coping mechanisms. That way you will come out of those things with a less suffer. That's the intention. Okay. Hope that resonates with you. And if you have already have some mechanism that you do, come and share with me. Otherwise, ask me questions on the DM. So, so as I promised, I will do this on the weekend, like a 1.5 hour or 90 or 120-minute session, where I'll go into much deeper. Probably I will do it on the Zoom so that people can see the presentations I have made for this, and they can see, they can participate in much deeper level, and also maybe get some personal suggestions too if they want, or they may just gather from the top. They don't have to reveal what the illnesses they have, but generally body gets diseased, mind gets diseased too. So there is a way to understand that and also really uh, cope with it, okay, with a good positive way, not being depressed or anxious about it. Okay. See, what is happening is people work all the time, and they develop some habits that makes you sick. That's what I wanted to point out in my proactive wellness sessions, and see whether they are doing all that is needed. Like, for example, the pillars of wellness, are they doing? Eating, are they exercising, are they sleeping, are they keeping their mind calm? These 4 pillars, I explore them. And also, after you took care of the body and mind like that, what is a human being? Go inward and find out your inner being and stay there, and then observe the mind, observe the body. That is much easier to do that. But you already developed a ego, a persona, then you will not be able to see the presence of you, which is really having the thoughts, emotions, and the body reactions and all that. So once you are in that as a human being, you have the intelligence to fix yourself in a much deeper way. Don't talk about it. Look at it. Are you able to observe your thoughts? Are you able to really see your emotions? Are you able to look at how your body is behaving, reacting, and all that? Are you stuck with your body? Do you identify with the body? Do you identify with your land uh, impressions on your mind? You were conditioned by the mind. You got to find that out. And then liberation is when you are really detached from the body and the mind in that way. Okay? So then you can have a good body, you can have a good mind, but they should not be a source of suffering for you. Okay? But eventually you'll be graceful about passing away with peace, not in fear. And as you live very well as much as possible. You will make effort to be living well in the present. That's what my proactive wellness is all for. Okay, reduce the suffering, make them aware of some of things that they can do proactively in their life, in their lifestyles, and prevent a lot of illnesses. It's really unbelievable how many people are so knowledgeable about so many things, but they don't really pay attention or aware of what's going on in their own body. Only a few people, fitness nuts, are people who are really see that I want to live a good life. I want to live a life that is where I can do what I want to do and where I can really not cause so much of headache for other people or spend a lot of money on my well-being and also losing the ability to enjoy myself, right? That kind of thing. So that's why this effort all the time. Okay, understand the goals why I'm doing what I'm doing and you make use of it. If somebody like me or anybody else comes in the same vein, they're trying to offer you the coaches and all the people that are working here. They offer you different things, right? So you want to understand them. You want to take the insights. You want to execute them in your life. That's what I'm trying to do. That's how I serve, right? I serve people to understand. Somebody has diabetes in their family and you're a young man or a young girl, you could take care that you can change the diet, you can improve it. All that requires some kind of awareness, some kind of change of habits you already had, that kind of work, right? People are not doing that. They get through, they come, they allow the diseases to get going on their own, automatic pilot like, and they continue like a bad diet or sedentary activity or too much tension, lack of sleep, too much information. All these things I talk about all the time. So the modern lifestyles are really something you want to look at. Look at with objectivity, look at with common sense, look at whether they are making you sick in the long run. My argument is you don't need to get sick. That is what I learned from the yoga and from the ancient people. They lived an average age of 125, and relatively they were moving and they were doing a lot of stuff, and they had a mind that is silent, and they had experienced the bliss of human being. But most of the modern society is after of something that they think out there, and then they are neglecting their inner presence of this happiness, peace, and bliss. So I want to people live well in that way, live well for a long time, and really have good time while they're here. Okay, thank you. And anybody wants to come, I'll give one more time, and then I will be closing. Okay. Look for me on Saturday. I'll be doing this. Okay, next time. Bye bye.